Australian National Chronic Disease Strategy is a document that provides national policy directions to improve chronic disease prevention and care around Australia. It seeks to improve health outcomes and reduce the impact of chronic disease on patients by prevent or delay the onset of the disease, reduce the progression on complications, maximize the well-being and quality of life, and reduce avoidable hospital admissions. The document outlines the need of committed actions from all the sectors and settings that impact on chronic disease prevention and care, both within and beyond the healthcare system. One of the 12 chronic conditions identified by Australian Institute of Health and Welfare is chronic obstructive pulmonary disease, COPD. COPD is a lung disease that prevents proper breathing, and as in the case of Mr. Peter Simonovsky, 67 years old male, despite the optimal medication therapy, patients often experience symptoms severe enough to limit their normal physical activities of daily living and affect their quality of life. As in any chronic disease, in COPD, day-to-day care responsibilities fall most heavily on patients and their families. That's why now we are looking at the action area of self-management. Self-management is one of the 4 essential areas of Australian National Chronic Disease Strategy document, and it's about patients being actively engaged in their own health care. It concentrates on skills and resources needed to carry out medical regimes specific to the disease, guide health behavior changes, and provide emotional support to patients to control their disease and live functional lives. Current approaches to self-management include Flinders model, which is clinician-led, and the Stanford model, which is patient-driven. The area of action of self-management includes supporting patients to understand the nature of their illness, including risk factors and comorbidities. Mr. Simonovsky was supported to understand the self-management of his condition by provision of teaching materials that include basic information about COPD, breathing and coughing techniques, and relaxation exercises. Preventing and controlling symptoms through proper inhalation technique were taught by the nursing staff. Monitoring signs and symptoms of his condition and action plan to respond to acute exacerbation was made for him too. Symptom monitoring lists for different situations like stress, environmental change, and respiratory tract infection were linked to appropriate therapeutic actions. Adopting a healthy lifestyle that reduces risk and promotes health was incorporated in Peter management plan too. Nicotine replacement therapy was used to help him quit smoking, and nutritional services were involved to educate him on healthy diet options. Peter was involved in decision-making process of adjusting his house to his needs. Stationary bicycle was installed as he preferred home exercise program than the group training. In many patients with COPD, like Mr. Simonovsky, anxiety and panic attacks are frequent complications due to constant shortness of breath. Better psychological support and strategies like general support, specific behavioral training, and appropriate use of anxiety medications would be beneficial for them to better manage their condition and enhance quality of life.